Hi, my name is Christina Harlan-Beaties. I'm a nurse practitioner at the University of Rochester Medical Center in Rochester, New York. Clinically, I specialize in otolaryngology and have had the opportunity to work in leadership role for our department's advanced practice providers for the past 4 years. A year into my leadership role, I had the opportunity to work with our CMIO on a department-wide project to improve documentation efficiency for our provider group. Throughout the course of the project, I learned that I really enjoyed evaluating and optimizing workflows and efficiencies, and decided to take certification courses to advance my knowledge of the EMR in order to become Physician Build certified. Shortly after starting the coursework, I received an email from the CMIO that he was creating a more robust provider informatics infrastructure for the URMC enterprise. The infrastructure would consist of a CMIO, 2 ACMIOs, and 5 directors of provider informatics. The roles would be predominantly filled by physicians, but he felt it was also important to have an advanced practice provider on his team. If I were being honest, when I received the email, I had to actually look up what informatics meant, and I wasn't afraid to tell him this when I met with him. He insisted that informatics could be learned, but that what he was interested in was creating a team of people that he felt could help serve as the next generation of leaders for our organization. And he saw those leadership skills in working with me on the project a year prior. I applied for the position and was hired as one of the directors of informatics. The learning curve was giant, as was my imposter syndrome for those first 6 months. Between working with all physicians, none of whom I had really met before, not understanding any of the acronyms used, and being an informatics novice, I was certain I had made the wrong decision entering such an unfamiliar territory. But at the same time, I loved being in a space that allowed me to look at the bigger picture, to be a part of a team that would have the opportunity to be change agents, not just in the information technology tools we use, but potentially in much greater ways. With time, a lot of active listening, and independent learning, things improved, and I eventually felt like I had my feet under me again, and I was ready to be a leader for this team. A major objective of mine was to be a voice and an advocate for the advanced practice providers in our organization, the nurse practitioners, the physician associates/assistants, the certified nurse anesthetists, and the certified nurse midwives, to ensure that when our organization was thinking about provider experiences, provider wellness, provider workflow efficiencies, we were thinking in terms of all provider types. My physician colleagues listened to my desires and quickly stepped up to be an advocate for those objectives of mine. We changed the name of our Physician Advisory Council to Provider Advisory Council, our Physician Builder Group to Provider Builder Group, and on more than one occasion, I have been in meetings where my physician colleagues advocate to their physician peers that they use the term provider instead of physician. As I stepped outside of my organization and sought opportunities for growth in the healthcare informatics domain, it became quickly apparent that national communications resources and opportunities for engagement were really more geared towards physicians and nurses. There weren't steering committees for advanced practice providers and national informatics associations or through large EMR companies. This is disheartening, discouraging, and frustrating. It has also served as a challenge for networking and creating a unified voice. This gave me a greater appreciation for my team and for my organization and their recognition and advocacy of involving APPs into this critical area of healthcare. The Association of American Medical Colleges estimates that there will be a shortage of between 37,000 and 124,000 physicians within 12 years. A study published in the New England Journal of Medicine predicts that physician workforce will grow by 1% over the next year, where the NP and PA workforce will grow by 6.8% and 4.3% respectively. Advanced practice providers are a great asset to the healthcare system. It is well documented that the integration of APPs into clinical setting has a significant impact on patient access, patient experience, and department revenue. It is crucial, perhaps now more than ever, that we think innovatively and strategically about how we best utilize all of our healthcare providers, not only in the clinical sense, but also in other domains of healthcare, such as healthcare informatics.